Mistletoe therapy is a plant-based complementary treatment, sometimes used alongside standard cancer care to help support a patient's quality of life. Mistletoe is a semi-parasitic evergreen plant that grows on the branches of deciduous and coniferous trees. More than 1,500 species have been identified, and mistletoe has been used for centuries in traditional medicine for various conditions. Mistletoe contains biologically active compounds found in its leaves, stems, and berries. These include lectins and viscotoxins, which may help modulate the immune system. Other components such as phenolic acids and triterpene acids may also contribute potential anti-cancer effects. Whole plant mistletoe seems to work better than isolated compounds because complete mistletoe extract appears to inhibit tumor cells more effectively. In cancer care, mistletoe extract is typically given by injection under the skin, intravenously, or sometimes directly into tumors. It is used as a complementary therapy to support the immune system, not as a standalone cure. Mistletoe therapy has been used as a supportive cancer treatment for about 80 years and remains popular in several European countries today. Benefits include that some patients report improvements in appetite, sleep, energy levels, and pain tolerance. Mistletoe extract also spares normal cells from degradation. Compared with many cancer treatments, mistletoe therapy is relatively affordable, although it is often paid for out of pocket because it is still considered an alternative treatment. Mistletoe therapy still remains controversial though, because studies show mixed results, and its effectiveness in treating cancer is still uncertain. In some cases, there may be a risk of anaphylactic reactions in patients who have allergies or immune reactions to cancer drugs. While reports suggest mistletoe is generally well tolerated and may offer supportive benefits for cancer patients, larger and better designed studies are still needed to clearly define mistletoe's role in cancer care.